Good morning and welcome to the Inside Upside webinar series. I would like to begin by acknowledging the traditional owners and custodians on the land of which this event takes place today and pay my respects to elders past and present. I'm coming to you from Mitigation on the lands of the Turrbal and Yagara people. I would also like to extend that acknowledgement to any Aboriginal and Torres Strait Islander peoples who are joining us today across the web. My name is Sam Clark and I'm a nurse educator here at Insight, and I have the pleasure of facilitating today's webinar, Trends in the Australian Illicit Tobacco Market. This presentation will provide an overview of Australia's illicit tobacco market and will include new and unpublished findings from the 2024 Global Drug Survey on Trends in Australians' Illicit Tobacco Use. Our presenter today is Dr. Cheneal Puljevic, who is a Senior Research Fellow at the Centre of Research Excellence on Achieving the Tobacco Endgame with the School of Public Health under the University of Queensland. We'll have time for questions following Cheneal's presentation today, so please type any queries and questions that you may have for her in the chat, and I'll ask them on your behalf at the end. Welcome, Cheneal, and over to you.
Great, thank you so much, Samantha, and good morning, everyone. Thank you for joining. As Samantha said, I'm Cheneal Puljevic. I'm from the University of Queensland, and I'm going to be speaking to you about Australia's illicit tobacco market. This is a subject that I've been studying for about a year and a half now. It's part of my fellowship, which focuses on the drivers and deterrence of Australia's illicit tobacco market. And we've got a number of research projects ongoing on the topic. So today I'll only be presenting some very early findings from one of them, but there will be a few studies coming out from our centre on the topic over the next few years, hopefully, if all goes according to plan. I too would like to acknowledge the traditional owners of the unceded lands that we meet on today. For me, it's the lands of the Yagara and Turrbal people, and pay my respects to the elders past and present. So I'm going to begin by describing what illicit tobacco is, and I'll then show you some data that shows us the recent trends in the market regarding Australians' use of the product. Next, I will cover 4 of the main reasons why the market's of concern, and then discuss some potential drivers of the market, and then show you some results from the 2024 Global Drug Survey on respondents' use of illicit tobacco, and then I'll finally touch on some policy responses that may be effective in addressing the market. So illicit tobacco products refer to any products for which the necessary duties and taxes haven't been paid. There are typically 3 kinds. So first, there is unbranded loose leaf tobacco, usually called Chop Chop in Australia. This is usually sold in clear Ziploc bags. So here in this photo, you can see some bags of Chop Chop amongst a recent seizure in Gatton in Queensland. Chop Chop is typically produced domestically, and domestic production of tobacco has been illegal since 2006. Here you can see an ABC News article describing the destruction of $31 million worth of illicit tobacco crops in Victoria, reported in February last year. Second, there are counterfeit tobacco products. So here you can see an example of an illicit tobacco pack, but the packaging is counterfeit and it perfectly mimics Australian plain packaging with the graphic health warnings and the text warnings. We know that this is illicit because my friend only paid $14 for these, and also Manchester brand are not legally available for sale in Australia. We are seeing more and more packs like this that are counterfeit, that do look Australian. It's not just the Manchester brand. One of the other slight giveaways is that the pack itself is not as good quality as the legal packs. So the edge of the cardboard was already starting to peel, but on the legal products, you have to look really closely to even find the seam. And then a third form is illegally imported foreign branded packs. These form around 85% of the Australian illicit tobacco market, so definitely the most common type we're seeing. This photo is of a pack of Marlboros that my neighbour smokes, and he bought these for $5 a pack from a tobacconist in North Brisbane, compared to the $55 that he would pay to buy these illegally. What's interesting is that he was originally paying $15 per pack, and then 13, and then the price reduced further to 9, and then 5. And so he asked the tobacconist why, and the vendor said that there's so much competition in the area that he's had to lower his prices. So how prevalent is it? Of course, there are inherent challenges in accurately estimating the prevalence of use of an illegal substance, never mind an illegal product that is also available legally. So keeping those challenges in mind, there are a few data sources in mind that we can use to track trends in illicit tobacco use, but unfortunately all are rather sparse. So we do have quite limited data on the amount of illicit tobacco that Australians are using. But I'll show you some of these figures. So first, here are data from Australia's National Drug Strategy Household Survey. Here we can see an increase in the percentage of the population who smoke, who report purchasing tobacco products without plain packaging between 2016 and 2022-23. So you can see in 2019, it was just over 6%, and in the most recent survey, it was just over 10%. And that difference between those final 2 years is statistically significant. Next up, we have data from the Australian Taxation Office, which is rather sparse. Unfortunately, it's just one web page with 2 graphs and a table, but it is the most comprehensive data we have on illicit tobacco use in Australia. And it just shows seizures and the estimated amount that their estimation of the amount that went undetected in the market as well. So all of their data is shown in terms of the duty value of the products they've seized. And they don't give much detail on how they calculate that, but anyways, you can see that there is a clear increase in the seizures over recent years. So in the first year there, 2015-16, the total seized amount was worth 135 million in duty value, and then it gradually increased to 2019-20, where it was worth about 796 million. And then we see a sharp increase in the last 2 financial years. And it more than doubled in that one financial year to just over $2 billion. Overall, the ATO estimates the size of the market has tripled in the time frame shown in this graph, and they estimate that illicit tobacco products now comprise about 15% of the overall Australian tobacco market. And a year ago, that estimate was 10%. So, yeah. I should also mention that they estimate that they only seize around 1% of the total market. So this number is likely a significant underestimation of the true figure. And then from the Australian Border Force, all we get is this one paragraph in their annual report. So all you need to see here is that they estimate a 16% increase in the market between the 2020 and 2021 financial years with $250 million. Before I move on, I just want to add a quick side note about tobacco industry funded research. There is clear evidence that the tobacco industry publishes overinflated estimates of the size of the illicit tobacco market as a strategic political tool to lobby governments to lower tobacco taxes and oppose new tobacco control policies. Here on the screen, you can see an example of a report published by KPMG, funded by Philip Morris, that it's a 2018 report, and they estimated that 2019, they estimated that 14% of Australia's overall tobacco market was comprised of illicit products in 2018, while the Australian Taxation Office estimated this figure at 5%. A systematic review of industry-funded studies on illicit tobacco by Gallagher and colleagues noted that these data are not reliable and that there is a fundamental lack of transparency throughout every stage of their research process. For example, most of these reports don't even have a methods section. There's also evidence that some tobacco companies deliberately divert their products into the illegal market to increase sales. It is crucial to keep this in mind when researching the illicit tobacco market to ensure that one is only using independent data sources, just as I am for this presentation. Now, onto reasons why the recent growth of Australia's illicit tobacco market is of concern. There are a number of reasons, but due to limited time, I will just focus on 4 of the main reasons. So first, it's clear that illicit tobacco products undermine the intended impact of tobacco control policies, such as tobacco tax increases and plain packaging. There is strong evidence for the effectiveness of both of these policies at reducing tobacco use at a population level, especially tax increases. So, of course, it's clear that the widespread availability of very cheap tobacco products, most of these in branded packaging, undermines these policies and perpetuates tobacco use. Second, the illicit tobacco market is naturally populated by consumers whose main concern is price. It makes sense that people with nicotine addiction who are unable to pay the high price of tobacco in the legal market may turn to buying cheaper illicit tobacco products rather than quitting smoking. This then perpetuates already high levels of tobacco-related diseases and increases tobacco-related expenditure among those experiencing socioeconomic disadvantage. Third, the illicit tobacco market is resulting in substantial losses in tax revenue for the government that could be spent on other things like health services. And while this is partly due to Australia's very high tobacco excise tax compared to other countries, a loss of $2 billion in a single financial year is certainly something to take note of. And I mentioned earlier, this number is likely a significant underestimation of the true figure. And then fourth, this is where it starts to get really interesting. There is evidence that the illicit tobacco market is largely operated by organized crime syndicates who capitalize on the product's high profitability to fund other crimes, such as the global arms trade and illicit drug production. Here's an ABC News article describing this issue in more detail, where they quote the CEO of the Australian Criminal Intelligence Commission. He said that the amount of profit organized criminals make on just one container of cigarettes means they only need 1 out of every 30 containers to get through the border to still make a profit. He said that while the profits are not as much as illicit drugs, the penalties are a lot less, and so the risk-reward payoff is a lot more favorable to organized crime groups. A major consequence of this organized crime involvement is arson attacks on tobacco retailers, which I'm sure that many of you have seen in the news recently. As of April this year, there have been 71 arson attacks on tobacco retailers, mostly around Melbourne, since January last year. These attacks are believed to be perpetrated by organized crime syndicates, including known gangs and outlaw motorcycle groups. They're essentially approaching owners of tobacconists and telling them to earn or burn. So either sell our illegal products or we'll burn your shop down. In other cases, tobacconists are reportedly targeted because they are controlled by rival syndicates, as you can see in the article on the top left. There's been some debate in the media over the past few weeks about what factors drive the market. A number of people have been blaming Australia's tobacco taxes, with some even saying that this is the only factor driving the market. Last week, there was a comprehensive article on this topic on the ABC News website. I recommend the article. It's very interesting with lots of nice graphics. And they quote a former AFP police officer who's quoted as saying that the #1 driver of the problem is the enormous price of tobacco. I then made the mistake of reading the comments section on Twitter. I mean, it does make sense. So, I mean, if you're my neighbor, why would you spend $55 on something that you can get for $5? Well, I've done a lot of reading and thinking about the topic, and although I do think the price difference is a major driver, the overall situation is a bit more complex than that. So instead, based on the literature on this topic, I hypothesize that Australia's illicit tobacco trade is facilitated by a complex interplay of demand and supply side factors, including both price-related and non-price-related factors. So first up, on both the demand and the supply side, there is price sensitivity, which considers the relative affordability of legal tobacco products. So that is, of course, where the tobacco tax increases come into play. On the demand side, the relatively higher prices of legal tobacco products compared to the illegal products drive consumer demand for the cheaper products. And then on the supply side, providing incentives for organized crime syndicates to smuggle these products into the country that result in high profits with much lower risk than smuggling illegal drugs like cocaine or heroin. But I don't think this is the only driver of this market. Next, on the demand side, we have consumer preferences, whereby individuals are willing to purchase certain products based on the acceptability of alternatives, their nicotine dependence, their brand loyalty, and peer and cultural influences. For example, a lot of people who have moved to Australia from other countries report preferring brands from their home countries, and that's why they engage in the illicit market. Next, on the supply side, is the strength or capacity of regulatory enforcement, including general governance and the capacity of tax administration authorities. Until last year, Australia's border force only had sufficient resources to search 7% of incoming shipments. So, of course, that makes it much easier for these products to be smuggled across the border, especially when they're very cleverly concealed. So some of them are hidden inside toys or teddy bears, for example. And this then facilitates the widespread supply of these products that we're now seeing. There are also several limitations in the law that currently prevent prosecution of retailers selling these products. So at the moment in Queensland, for example, police are limited to seizing the stock within the shop only. They're not allowed to seize any product stored outside the shop. So if the retailers are keeping only half a day's worth of stock in their shop at any one time, and then if they're raided by police, they can very quickly restock from a van parked outside or a storage facility nearby. Police are also currently following an educative approach, meaning that the first few times a retailer is busted selling these products, the police are only allowed to provide education. The government are in the process of strengthening the laws to overcome many of these loopholes, though. And in January this year, the government announced that 188 million has been committed to the Australian Border Force to boost their capacity to enforce compliance. So we'll wait to see if this has an effect. And in Queensland, the TOSPA laws, which govern all of this, are also being amended to increase police power to seize the products and prosecute the retailers. Then, of course, I've already described the involvement of organized crime syndicates. They are obviously motivated by profit, and there are enormous profits to be made with very low risk of prosecution. Plus, this prosecution is usually limited to fines, which they can more than afford. The widespread availability of illicit tobacco products that we're seeing across the country shows that these organized crime syndicates have the capacity to ensure that supply is widely available. So yes, the price sensitivity does drive the demand, but these organized criminals' capacity is meeting that demand. If anyone thinks I've missed anything here in this model, please do reach out. It's a complicated topic and I'm still getting my head around it. Right, so let's move on to the second part of the presentation. I'm now going to discuss the patterns of illicit tobacco use among respondents of the 2024 Global Drug Survey. And I'd like to acknowledge my co-authors for this study, especially Alice Holland, who created the graphs that you're going to see today. So I've told you about Australia's illicit tobacco market in quite a bit of detail, but let's expand our focus by looking at other countries, because this is the Global Drug Survey after all. Internationally, there is limited data also, but from what we do have, we can see varying trends. So some researchers estimate that overall the global illicit tobacco trade is shrinking, but we also know that there are many individual countries reporting notable increases in illicit tobacco use in recent years, like Australia, South Africa, and England. Unfortunately, there aren't any studies showing international trends over time, but Mark Goodchild and colleagues completed this review in 2022, estimating the size of the market in each of these countries. So on the left with the biggest markets, you can see countries like Latvia, Brazil, and South Africa. And then on the right, the smallest markets, they estimated countries like Italy, Austria, and Greece. This is a little bit outdated now, so they've put Australia there, but based on the most recent estimate from the ATO, Australia now is somewhere here. And I'm pretty sure South Africa is a lot higher now as well. So internationally, there's actually surprisingly very little research on illicit tobacco use, particularly studies that involve consumers. As such, we don't know very much about even the most basic things like consumers' frequency of use, what kind of products they're using, where they're getting them from, and why they're using them. And that's why this study aims to explore the patterns, drivers, and potential deterrents of illicit tobacco use among a global sample. The data source for this study is the Global Drug Survey, which is the world's largest survey of drug use. It's been running annually since 2013 and typically recruits very large samples of over 100,000 people across the world each year. To take part, respondents must be aged 16 or over and have used at least one substance in the past 12 months, including alcohol or tobacco. The survey recruits respondents through the promotion of the survey in social media and news articles, and also me hounding people excessively via email. As such, this is a cross-sectional convenience sample with an overrepresentation of people who use illicit drugs. The 2024 Global Drug Survey was open from January until the end of April this year, so you are among the very first people in the world to see any of the results. The survey did include a module on illicit tobacco, including patterns, drivers, and deterrents of use. So we had 7,391 people complete this module. They had a median age of 32. Most were male, and the most common countries of origin for the people who answered this module were Spain, Germany, France, USA, Mexico, Australia at 7.6%, and the UK. So for each variable, you can see the data from the Australian respondents in orange and the overall international sample in blue. So when we ask people, would you know how to purchase illicit tobacco to measure the kind of availability of the products and how easy it is to purchase? we can see that the Australians in orange were most likely to answer that they definitely do know how to purchase illicit tobacco if they wanted to, whereas the international sample were most likely to answer definitely no. You can see from the blue bars, which is interesting. In terms of the types of products that people report using, the Australian and international samples were most likely to report purchasing the branded rolled cigarettes, like the Marlboro pack that I showed you at the beginning. And then if you look at the Australians, you can see that unbranded loose tobacco, chop chop, was also quite common. Next, we asked respondents whether the last product they bought was a pack of cigarettes or loose leaf tobacco, and then asked them how much they paid the last time they purchased it. We're still in the process of cleaning the data. It's quite difficult because of all the different kinds of products and all the different sizes of the packs and the bags and so on. But Alice did a very quick analysis for me. Thank you, Alice. And we found that for one pack of branded cigarettes, the Australians report spending a median of $15 and a range of between $10 and $50. So here we need to keep in mind that the tobacco excise tariff works out to about $26 per pack of 20 cigarettes. So anything costing less than $26 is clearly illicit. And at Coles, the cheapest pack of 20 cigarettes that you can buy is $32. So this is less than half of that. And then in terms of the unbranded loose tobacco or chop chop, the Australians report spending a median of $25 for a 50-gram bag and a range of between $17.50 and $35. At Coles, the cheapest 50-gram bag of loose tobacco is $142. So yeah, quite a big difference there. I will quickly mention that the unbranded loose tobacco isn't always the greatest quality. Someone told me they found bits of glass in theirs. Some forensic analyses have often find mold because they add water to the bags to increase the weight. Also rat sack, a few other things. Yeah, so it's definitely not the greatest quality in general. And then in terms of reasons for use, unsurprisingly, it's relatively cheaper price compared to legal products was the most commonly reported reason among both samples that you can see at the bottom. There are a few people who say that they use it because they don't want to pay more taxes to the government, which I find interesting. Then we see, as I mentioned, the immigrants who prefer to smoke cigarettes from their home country. Some people find it easier to purchase, some prefer it, saying tastes better, and some even think it's healthier. And that's often the loose leaf tobacco. People think that because it's kind of the organic matter in a bag, it's healthier than cigarettes where the tobacco companies have added nasty chemicals to it. There is a study on this, a qualitative study asking people why they use it. So that I find very interesting that some people actually think it's healthier. And then finally, in terms of what would deter people from using it, well, unfortunately, you can see at the top there that the most common response from both samples was that they do not intend to stop using it. But among other people, finding out that it might be more harmful to your health than legal products was a common reason, or that it funds terrorist organized crime syndicates were the next most commonly selected response. So this is very useful for us when designing potential research studies or policies that aim to prevent consumer purchasing of the product. So then on the notes of deterrence, what can we do about all of this? Well, as I mentioned earlier, only approximately 7% of the imports are robustly examined at Australia's borders. So a fairly obvious response is to boost the ABF's capacity to search more incoming shipments. And the 188 million that was committed to the ABF at the beginning of the year will perhaps assist with this. Time will tell whether this was sufficient to have an impact. A second opportunity to better mitigate Australia's illicit tobacco trade is increased prosecution of retailers. Currently, the Australian Border Force and the Illicit Tobacco Task Force that has been set up focus their efforts on large-scale crime syndicates responsible for smuggling illicit tobacco into Australia or growing large crops. And there is minimal enforcement or action taken against retailers who play a key role in distributing the products to consumers. The current maximum federal penalty for selling illicit tobacco products is a fine of up to $313,000, but usually much lower than that. These penalties are clearly not a successful deterrent because there's a parliamentary inquiry on this topic that was completed in 2019, and they described the case of a retailer caught selling illegal products 5 times. But in June this year, the Queensland government implemented new laws that make it illegal for Queensland retailers to supply, store, or possess illicit tobacco. And as I said, provide new powers for Queensland enforcement officers to investigate and seize these products. So again, time will tell if this makes a difference. Next is the implementation of tobacco retail licensing schemes across all Australian states and territories. This basically involves retailers needing to apply for a license to be allowed to sell tobacco. And this allows authorities to have oversight of how many tobacco retailers exist and where, which seems like quite important information that hasn't always existed up until now. Plus, it means that retailers caught selling illicit tobacco can have their licenses cancelled, which may be an effective deterrent to selling these products. There are 3 states that currently don't have these schemes, Queensland, Victoria, and New South Wales, but Queensland's licensing scheme will launch in September this year. And although New South Wales doesn't have a formal licensing scheme, they do have a tobacco retailer notification scheme that does allow the state government to impose a tobacco retailing ban on retailers who don't comply. Victoria has announced that legislation to introduce tobacco retailer licensing will be introduced into Parliament before the end of this year. So we'll all be watching carefully to see if this mitigates the arson attacks that have been so prevalent in Victoria over the past 18 months. Next, a few countries like Canada, Malaysia, and the United Kingdom have implemented mass media campaigns in an attempt to reduce consumer demand for illicit tobacco products. These campaigns aim to raise awareness of the extent of the trade, penalties for buying or selling these products, and promote the criminality of the trade as a potential deterrent. So this is where the Global Drug Survey results will be useful. We saw in the GDS data that a decent proportion of the respondents think that awareness of the criminality of the trade may be an effective deterrent to buying illicit tobacco. So here's an example of a mass media campaign from the UK that promoted how the illicit tobacco market increases tobacco use among children. And the second one highlights that the market is operated by criminals. This campaign was quite effective. It resulted in a significant increase in calls to the hotline where people could report illegal sales of these products. So we are currently working with the Queensland Police Service on a research project to investigate which messages may be most effective for an Australian mass media campaign like this that aims to deter consumer purchasing of these products. Again, don't know how effective it will be, but if it has even some effect, that will be welcome. And then number 5, I'm aware that this is a controversial idea for some, hence the question mark, but some people have hypothesized that if safer alternative sources of nicotine were more easily available and affordable, for example, regulated e-cigarettes with medical grade e-liquid, this could facilitate people quitting smoking and thus quitting illicit tobacco too, as they would have a safer and satisfying alternative source of nicotine to switch to. Illicit tobacco products are now often the cheapest source of nicotine available, so cheaper than most vapes now. And we're hearing of stories of people switching from vaping to smoking illicit tobacco because the illicit tobacco is cheaper, and that is certainly cause for concern. And then finally, the approach that some researchers say holds the most promise for addressing this market is the implementation of a track and trace system. A track and trace system involves placing a unique, secure marking on every cigarette pack that provides information on the pack's manufacture, shipping, and distribution. As such, if a legitimately produced product enters the illicit market through smuggling, it can be traced to determine its origin and the entry point at which it exited the illegal supply chain. And the secure markings also discourage counterfeiting. The track and trace system is considered by many to be the intervention with the most potential to effectively minimize the trade. Currently, Australia's tobacco plain packaging regulations prevent implementation of such a system because there's restrictions on tobacco packaging, like what colors you can use and markings and so on. But there is new tobacco control legislation, may have already been through Parliament. Ooh, I should check that. But it includes provisions that would allow for these markings to be added to cigarette packs. So we'll see. The track and trace system is actually a major component of the World Health Organization's protocol to eliminate illicit trade in tobacco products. This is an international treaty signed by 54 countries that aims to facilitate international cooperation to address all forms of illicit tobacco trade through a suite of measures, the primary one being the track and trace system. However, Australia is one of a few countries that have not signed the protocol. So I'm running out of time to discuss the issue in more detail, but if you are interested in finding out more, then I can very, very humbly suggest reading our commentary on this topic that was recently published in the International Journal of Drug Policy. All right, that's all from me. Thank you very much.
Thank you, Cheneal. A bit of an eye-opening presentation, certainly for myself, with some of the details about the illicit tobacco market. We have got a couple of questions that have come through, but I'm sure within the next kind of few minutes we'll have more as people digest some of the information that you have given them. One of the first questions that's come through, it says, can track and trace work for farm to consumer, for example, organic product in the bag? Track and trace appears to only function for product manufacturing, for example, a packet.
Yeah, that's absolutely correct. We wouldn't be able to add a track and trace to the chop chop bags. So, but yeah, as I said, the branded packs are about 85% of the current market, so it would potentially have a pretty good impact.
There's another question that said the cost of living. Has this increased the amount of products available or seen any significant changes to the market?
I'm pretty sure that it has increased consumer demand for sure, and everyone's feeling the pinch. And if you can buy these products for cheaper, then why wouldn't you? So yes, cost of living is certainly driving demand. But yeah, and then the supply is facilitated by the organized criminal syndicates who are realizing how much profit there is to be made and probably capitalizing on the fact that people are feeling the cost of living.
Absolutely, and interesting the comment that you had from the real life from your neighbour who, was able to buy cheaper and cheaper because of the supply and demand,
Yeah,
the
exactly.
competition. Yes.
Yeah.
Something we don't often think about in the illicit market, the kind of the competition from other suppliers, and especially with that lack of regulation as to the sales in Queensland in particular.
Yes, exactly.
There's another one says new tobacco control measures were implemented from the 1st of April with a compliance date of the 1st of July 2025, such as standard sizes of pouches and sticks, a different taste, a different look. What are the expected outcomes from an Australian market and how will the impact be measured?
Great question. There is mixed research on this topic. Some research shows that packaging design features can be quite effective in deterring people, but then there's other research showing that consumers pay very little attention to the packs, and that, for example, they consider the graphic health warnings to be the extreme cases from people who use tobacco, and like, oh, that's, the pictures are so extreme that like, oh, that will never happen to me kind of thing. So I guess time will tell. I'm not sure how the effectiveness of the measures will be measured. I mean, we can just look at tobacco use prevalence over time and see if there was any change at the time. But no, unfortunately, I'm not on top of all of that enough to be able to comment more than that.
Thank you. I suppose that leads us on to another comment that came through saying that obviously the new anti-vaping campaigns that are being seen around on media at the moment are more about the threats of social harms rather than those kind of graphic images that we're used to seeing on tobacco packaging. Do you think that that's a step in the right direction to, change the public's kind of view about tobacco?
Yeah, it's a controversial topic. My personal opinion is that I was quite what's the word? I was quite pleased to see that these new vaping ads focus on that aspect rather than the health harms. I don't think people like to be lied to. And teenagers are very aware of when they're being lied to. And we certainly from my own experience and from our research, people are definitely wanting to quit vaping because they don't like being addicted to something. So I do like the fact that those campaigns are focusing on the social harms and the kind of addiction side of things. I've only seen the one. I need to go and find the others. I haven't seen the others yet, but again, time will tell. I'm really not sure what's going to happen in the next few years regarding vaping and also illicit tobacco use. I'm really not sure whether any of these campaigns or regulations are going to have much of an impact.
I've only seen one of the adverts myself, so I'm not sure what the others will look like and what impact that might have.
Yeah.
There is another comment about the track and trace system, saying that it may be vulnerable to corruption, for example, falsifying place of origin or checkpoints crossed, particularly in countries with high levels of corruption.
Yeah, it's very possible. I believe that the marking would be placed by the manufacturer, and I don't know if it's something you could tamper with, but you never know. Growing up in a country with very high corruption, nothing surprises me anymore. So, yeah, I wouldn't be surprised at all if the corruption does influence that and enable people to mess with the system.
One potentially slightly controversial, would a decrease in the cost of tobacco products help to address the illicit tobacco market?
The eternal question. I don't know. I don't know is the short answer. It's something I think about every day. I just don't have enough evidence at my fingertips to be able to address that one. Sorry.
That's fine. How does your research manage the messaging that blurs vaping versus tobacco-based nicotine? I often hear people talk about tobacco, but then frequently messaging vaping. How do you manage this?
So different sources of nicotine from tobacco versus vaping. Sorry, could you repeat the question?
How does your research manage the messaging that blurs vaping versus tobacco-based nicotine? I often hear people talk about tobacco, but then frequently messaging vaping. How do you manage this?
Okay. I think the question's asking about people's misunderstandings about the harms of nicotine. Yeah, so whenever we have the opportunity, we try to outline the evidence that it's not the nicotine that's the source of harm in tobacco, it's the consumption, it's the combustion. And people often equate nicotine and caffeine in terms of the levels of harms. It is an ongoing problem that we have. A lot of people misunderstand the sources of harm from smoking. My colleague, Kylie Morfitt, has done a lot of research on this topic. Kylie's going to kill me for mentioning her name. But yeah, she's done a lot of research on people's understandings of the sources of harm and understanding of nicotine harms. So for example, last week I delivered a very similar version of this presentation, and someone in the audience asked whether homegrown tobacco could address this issue. And it just showed to me that there is quite a widespread level of misunderstanding about the harms of tobacco, and that it's not the source of the tobacco that's a problem, it's the tobacco itself. So in general, yes, there is quite widespread public misinformation about or misunderstandings about the harms of tobacco versus nicotine, and yeah, all of that.
And obviously the combustion versus the kind of the vaporization. Yeah, I think it's a common problem that people just associate tobacco is tobacco, and regardless of the kind of the method of administration or the method of use.
Yes, exactly. And that's why some people think that chop chop is healthier, for example. They think it's more natural and doesn't have the nasty chemicals added to it. Yeah.
Yes. Yeah. And as you highlighted throughout this presentation, there is that, we do know that things are added to increase the weight of products to increase profits without
exactly.
without that kind of oversight. Another question that's come through, the constant price hikes over the last few years could also be seen as prohibition through economics. This rise of the illicit market is a natural response to this. Are we looking at a tobacco-free country in the future?
So yeah, I think there's two parts to that. So firstly, about the economic prohibition. Yeah, I suppose, yeah, that person has a point. And until there are alternative forms of nicotine, I think consumers will continue to seek out these products. So for example, New Zealand were going to be implementing the tobacco in-game measures, so reducing the number of retailers by 90%, prohibiting tobacco sales to everyone born after a certain year, and removing the nicotine from cigarettes. But they were going to also accompany that with more widespread access to nicotine vaping products that would have been regulated by the government, so we would have known what was in them and so on. And so I do think that people did need access to those alternative products in order for those measures to be successful and not result in a black market. Whereas we see a very different policy in Australia, and it's a very controversial policy. There are researchers on both sides of the debate, and people get very heated on this topic. So it is something we prefer not to comment on. But yes, I do think that Australia, we are heading towards a tobacco in-game, which is something that we are quite pleased about. It is the Australian government's official policy is they're aiming to achieve less than 5% prevalence by 2030, and we may be on track to achieve that. So yeah, time will tell whether we do reach a tobacco in-game. The widespread availability of these cheaper products is certainly threatening our chances of reaching a tobacco in-game.
And I think it was
that was a bit rambly. I apologize.
No, absolutely. I know it was I'm sure the date was if you were born after 2009 or born in 2009,
Yes.
that was your cutoff for not being able to kind of access those products.
Yes.
It just makes me think of the what we've seen in Portugal with the illicit market there, where they changed their view and their tack and who they went after, and how they then transferred the money into kind of health promotion services and other services to support people, rather than the prohibition kind of view.
Yes.
Makes you wonder if that would be something that could be applied this way, but yes, who knows. We've got another question saying Queensland is fortunate now to have a walk-in drug checking service. With Chop Chop, can the drug checking service check what is in it? I wonder if other illicit substances like fentanyl could start appearing in Chop Chop.
So yes, Queensland is very fortunate to now have our walk-in drug checking service. That is one of my other hats. I'm the Queensland research lead for the Loop Australia, so I know all about that. And I know that Cameron presented on Checkpoint last week, which was really great. But no, unfortunately, the service can't check plant materials. So cannabis, fungi, like mushrooms and tobacco can't be tested, unfortunately. But I do think that there are forensic methods of testing the Chop Chop. I know some studies have done that, and that's where they found the mold and all of that other things. Could fentanyl start appearing in Chop Chop? I'm not sure. I don't think that's likely to happen, but yeah, you never know.
I suppose there is potential for any other substance to appear in the Chop Chop that's going to, increase profitability and, for that market. And I suppose this is probably one of the final questions for today, that says, you've just been appointed the Australian Health Minister and you've been given a $1 billion budget. What will be your first action on this topic?
I would give 95% of that to our research centre to investigate what would be the most effective action.
Good answer.
Yeah, no, I have to be guided by evidence. And that's why there's a lot of speculation in the media about the role of tobacco taxes and should we stop raising taxes. And I just don't feel comfortable commenting on any of that without evidence. I need the numbers and the figures and the data, and then I'll make my decision.
Yeah, and it's interesting to see that that's where some of the questions has come from, is from that basis of, exactly what you've said. So yeah, the research is the key to kind of looking at all aspects and getting those definitives that don't have, as you said earlier, that bias from the people who will profit in the end.
Yep, that's right.
Yeah, absolutely. Well, thank you very much, Cheneal. It's been very very interesting and very informative, and I'm sure with the questions and things that we've had, that people have took a lot from this presentation. We've had quite a few people say thank you very much, and and more thank yous coming through as I speak. This one from Cheneal marks the end of our semester 1 webinar series, so please keep an eye on your mailbox for the semester 2 calendar, which should land in your mailbox very, very soon. Also, don't forget to fill out the post-webinar survey. We do look at this for ideas and inspiration for our next series. So if you could take a couple of minutes and fill that in, we would love to hear your feedback. And we will see you next semester. Thank you for joining us, and thank you again, Cheneal.
Thanks very much.